Hello everybody, I'm Dr. Fereshteh Sedaghat, and I will talk to you about the neuromodulation of central nervous system. So, what do we mean when we say that the brain is functioning normal? A functional normal brain has normal brain waves, cerebral blood flow, oxygen and glucose metabolism, and normal neurotransmitters. A functional normal brain has the ability to organize its different states. Just as a healthy heart is able to change its rate to match demands and quickly settle down to a normal resting level, a healthy brain also should have the same flexibility. A dysfunctional brain has imbalance of brain waves, cerebral blood flow, oxygen and glucose metabolism, and neurotransmitters and chemicals. It has impaired ability to shift from one mental state to another. For example, it has too much of some frequencies over others or in the wrong place. Dysfunction of the brain has different manifestations, including cognitive symptoms, difficulty in processes like thinking, reasoning, memory, decision-making, and also a range of motor and sensory symptoms, including visual, auditory, emotional, and problems of behavior, problems of perception like hallucinations, consciousness problems, autonomic symptoms, such as heart rate. Here we can see the topographs of brain waves using quantitative electroencephalography. A brain that is functioning normally will produce the right brain waves for the right moment and then quickly return to the stable state. For example, it would be normal for someone to have more fast brain waves present while very excited, but not if that person is trying to switch off and get to sleep. The above picture shows us the excessive power of beta and high beta bands in frontal region bilaterally in excited state, although the same person after being relaxed has not the excessive power of beta and high beta bands. What do we mean by neuroplasticity? Many aspects of the brain can be altered even through adulthood. Neuroplasticity was first described in 1890 and is the ability of the brain neural networks to be modified chemically, structurally, and functionally throughout life in response to experiences, for example, learning new abilities and environmental influences. Neuroplasticity is an intrinsic property of the human brain. The ability of our brain to change and rewire itself as a result of what we do, thus adapt to environmental pressures, physiological changes, and experiences. It is a lifelong capacity of the brain to change itself. Neurons communicate with one another at junctions called synapses. At the synapse, one neuron sends a message to a target neuron of another cell. Our thoughts, feelings, actions, memories, learning, and imaginations are the result of what happens in our synapses and their networks. Neural networks makes us to be able to think and therefore to be, as was said by Descartes. Here I would like to modify it and say, I learned, therefore I am. What do you believe? Thinking comes first or learning? For example, most animals have limited thinking, but they have some learning skills. Also, most of what babies do is caused by reflexes. They aren't thinking about their actions. They will be sucking, swallowing, and so on, but they will think about their learning later. We will hear a video that I have made from the cats of my friends for you to see the different reactions of the cat playing with a doll. I only want to emphasize that learning is very important for us. Communication between brain cells is a bioelectrochemical event taking place in synapses. What is called learning and memory from neuroscience point of view? Learning is a neural alteration that provokes a change in the organism's behavior. It can be changing the amounts of neurotransmitters and changing the connections between neurons. What is called memory? Memory is essentially the formation of a neural circuit, the forging of a pathway among neurons. Can you imagine how do we keep track of what to do next? Learning, remembering, recalling memories, and everything we do are supported by multiple separate groups of neurons connected inside and across key regions in the brain. If these neural assemblies fail to sync together at the right time, these functions may be lost. Short-term memory relies on two key brain regions, the hippocampus and the prefrontal cortex. These brain regions interact with one another as memories are formed, maintained, and recalled at the level of a specific group of neurons, neural assemblies, and present viable targets for therapeutic interventions on the level of neural assembly interactions. Memories could be lost if two key brain regions fail to sync together. Modulating these neural assembly interactions, particularly via brain stimulation, may be helpful to enhance or restore functions that are impaired in a particular brain disorder. When we talk about neuromodulation, we mean that we want to use this ability of neuroplasticity of neurons for therapeutic reasons by strengthening or weakening nerve connections. That will be done by targeted delivery of a stimulus to specific key regions. Broad range of non-invasive neuromodulatory devices are available today that are not only provided to give insight into brain physiology, but can be used to modify the brain function for a variety of therapeutic purposes, including neuroenhancement. Transcranial electrical stimulation and magnetic stimulation are the most used non-invasive methods of neuromodulation, and also neurofeedback, audiovisual stimulation, and ultrasound stimulation are from non-invasive neuromodulation methods. Here we will not talk about invasive neuromodulation methods that are deep brain stimulation, motor cortex stimulation, and electroconvulsive therapy.
Some questions will be shown meanwhile to be able to test yourselves. Here we will learn a little about transcranial magnetic stimulation, transcranial focused ultrasound, neurofeedback, audiovisual entrainment, and transcranial direct current stimulation. So, transcranial magnetic stimulation is an electromagnetic induction therapy that uses magnetic fields for stimulating nerves in the brain. The principle behind this therapy is that when a magnetic field passes through a coil, an electrical current will be produced in the coil, which can stimulate neural networks. This therapy has been used to treat depression and other mental disorders since 2005. Each treatment session lasts about 30 minutes. rTMS stands for repetitive transcranial magnetic stimulation. The treatment duration usually lasts between 4 and 6 weeks. This number of weeks could be shorter or longer depending on every person's response. The exact biology of why rTMS works isn't completely understood. Here we can see the cerebral blood flow increases after doing TMS in a patient with depression. The patient's symptoms has been improved. A person who has metallic fragments in the body should not do TMS. Like aneurysm clips or coil stents, implanted stimulators, implanted vagus nerve or deep brain stimulators, implanted electrical devices, electrodes for monitoring brain activity, cochlear implants for hearing, any magnetic implants, bullet fragments, any other metal device or object implanted in the body. Transcranial focused ultrasound is an emerging brain stimulation tool for safety modulating brain circuits. It uses low-intensity, low-frequency ultrasound to stimulate neural activity and was proposed in 2002. The effectiveness of focused ultrasound activity on human brain has been demonstrated, and on hippocampal sonication with low-intensity transcranial focused ultrasound, the scientists have been seeing effects on cerebral blood glucose metabolism and cognitive function improvement in patients with Alzheimer's disease. It has direct action on bioelectrical neural activity and in addition
could be used for targeted drug delivery. However, its full development needs more understanding and control of safety measures. It is non-invasive and is a focused procedure that does not require the implantation of electrodes that could damage the nervous tissue. Neurofeedback is in fact a training system in which brainwave activity that is obtained by the sensors on the scalp of the same person is presented to the same person as a video display. When brain activity moves toward patterns of improved self-regulation, the display advances and gives higher scores as a reward. And if brain activity regresses, slowing or stopping, the score will decrease. That is like punishment. In my experience, neurofeedback is most useful to relieve ADHD and anxiety. It's for development of healthier patterns of activity. The goal of treatment is not only to change how you think and feel, but also to change your brain on a biological level for better functioning. Neurofeedback can encourage and speed up the process of neuroplasticity. Usually, words alone are not enough. Telling someone to calm down or focus doesn't solve the underlying issue of conditions like anxiety or ADHD. Neurofeedback allows us to speak to the brain with its own language, the brain waves. For example, I have put a video of one of my patients, and I asked the patient to make the face that he can watch in the monitor to smile. The more the smiling, the better the score. So the patient will understand by himself that he should stop his facial muscular tension to be able to get better scores. Now, what's audiovisual entrainment? Audiovisual entrainment uses lights that flash into the eyes while tones pulse into the ears. The frequencies of the lights and tones are in the brain wave frequency range, typically from 1 to 40 Hz. The brainwave synchronizer works on the principle of entrainment was introduced in 1959. Lights and sound from the synchronizer pulse at the speed of normal brain waves. Our brain waves will then follow as the light and sound stimulates and shift into the frequencies of another mind state. This is called the frequency following effect.
In 1963, it was reported a 90% success rate at reducing anesthesia during surgery while using this device. Bernard Margulis used it in the first brainwave entrainment in dental study in 1966, which reported less need for anesthesia, also less bleeding and less fever and anxiety. And also Dr. Kroger used it to help 200 female subjects in chair hypnosis to assist childbirth in them. In order for entrainment to occur, a constant, repetitive stimuli of the proper frequency and sufficient strength to excite the thalamus must be present. All sensory information except that of the smell must pass through the thalamus to gain access into other brain regions. The thalamus then passes the stimuli onto the cortex and associated processing areas such as the visual and auditory cortex. For instance, induced visual stimulation travels from the retina of both eyes down the optic nerve to the optic chiasm and into the lateral geniculate of both thalami. From here, the visual signals are passed onto limbic structures and then visual cortex. Audiovisual entrainment is avoided in those with photosensitive epilepsy, where flashing lights of certain frequencies may trigger a seizure. And now, transcranial electrical stimulation. It's the most clinical experience has been done with electrical stimulation, and it was used for more than 200 years based on the experiments of Aldini. The history of neuromodulation goes as far back as ancient times when electric fish were used to treat pain. The simultaneous firing of electrocytes results in the electric organ discharges which are emitted in the surrounding water. In strongly electric fishes such as the electric eel, electric catfish, and electric rays, the electric organ is huge, containing numerous electrocytes. Therefore, their discharge voltage can reach as high as 600 volts. In weakly electric fishes, which use electricity for navigation and communication, the discharge voltage is small, often less than a volt. Transcranial current stimulation works by sending low current through the electrodes. When these electrodes are placed in the region of interest, the current induces intracerebral current flow and alter neuronal excitability in the specific area being stimulated based on which type of stimulation is being used. This change of neuronal excitability leads to alteration of brain function, which can be used in various therapies as well as to provide more information about the functioning of the human brain.
Various companies have made various devices of electrical stimulation.
There are different modes of transcranial electrical stimulation. tDCS, transcranial direct current stimulation, begins with a ramp-up phase and ends with a ramp-down phase. It is used most than the others in clinical practice. In transcranial alternating current stimulation, alternating forms of electrical current at a specified frequency can be applied. In random node stimulation, unlike alternating current stimulation, the intensity of the current and frequency of the current change in a randomized way. The type of noise that is administered can be changed by adjusting the frequencies present within the random noise waveform. And there is transcranial pulse current stimulation, that is a biphasic pulse alternating current. Transcranial alternating current stimulation provides a rhythmic waveform that can be customized to target specific neural oscillations. The electrode montage can be customized to target any cortical region of interest. Although the mechanism behind these modes remains not entirely certain, there are some interesting phenomena that remain to be investigated in future.
Here I only want to show you that the administration of tDCS is simple. We will soak the sponge pads with normal saline and we will put them on the region of interest and we will set it in the program that we want. Under the anode, the extrapyramidal neurons will depolarize. On the other side, under the cathode, we have a hyperpolarized soma of extrapyramidal neuron. And we will have under the anode so many cells that are depolarized in red and so many cells under the cathode that are hyperpolarized in blue. The current has to go from one electrode to the other all the way. The actual pattern of current flow is much more as it seems here, all across the cortex and also subcortical regions, and has more diffused activation pattern. What will happen if we make the electrodes smaller? Only using smaller electrodes will not localize the current flow. We call the smaller electrodes high-definition electrodes. If we put the small electrodes closer, that will restrict the current flow. And if we use more number of cathodes, we will have higher definition electrostimulation.
Well, there are a variety of applications for using TES. Depression, migraine, stroke rehabilitation, stuttering, cognitive decline, chronic pain, vertigo, tinnitus, cerebral palsy, Parkinson, insomnia, anxiety disorder, and cognitive enhancement are amongst them. There are different montages to be used based on the indication. In case of treating depression, for example, tDCS currents specifically target the left side of dorsolateral prefrontal cortex. This region has been shown to be associated in depression. tDCS is able to achieve cortical changes even after the stimulation is ended. The duration of this change depends on the length of the stimulation as well as the intensity of the stimulation.
Now, I am willing to emphasize that when physicians view their patients as their most important teachers, the mutual sense of gratitude and respect cements the duality of the relationship and enhances the clinical experience for both. This is this relationship with highly individualized therapies that will result in enhancing health and well-being using new and affordable technologies. The devices by themselves do nothing. The potential mechanisms of action can be effects on regional cerebral blood flow, effects on non-neuron structures, modification of synaptic microenvironment, long-term potentiation effects. Long-term potentiation is a persistent strengthening of synapses based on recent patterns of activity. Also, complex interaction with neurotransmitter system modulating oscillatory brain activity and functional connectivity pattern. Cerebral blood flow and metabolism and neural network connectivity are altered in almost all neuropsychiatric pathologies. Here we can see the effects of tDCS in cerebral metabolism using FDG PET. Anodal tDCS induces increase in cerebral metabolism and also regional cerebral blood flow, while cathodal tDCS results in a decrease in cerebral metabolism and cerebral blood flow during and after stimulation. tDCS has effects on neuronal activity by modulating the membrane potential. Neuronal depolarization is frequently altered in neuropsychiatric pathology, and tDCS modulates cortical excitability. A neuron fires when it receives a sufficiently strong stimulus. The depolarization response to a stimulus might be large enough to pass a threshold. In anodal stimulation, the neurons being affected by the current will reduce the firing threshold by a few millivolts. A smaller threshold results in more neurons firing. This causes a change in voltage, and a change in voltage causes the sodium and potassium channels to open, and the exchange of ions produces an action potential or an impulse. Through long-term potentiation, the suprathreshold spike activity of neurons enhances the neuronal connection and increases signaling through postsynaptic dendrites. As was said, they have effect on EEG power spectrum. Here, you can see the alpha amplitude that reduces in frontal region comparing to sham group when doing tDCS over the left dorsolateral prefrontal cortex. And here we can see changes in delta, theta, alpha, and beta power of cathodal tDCS and sham tDCS, that is a placebo group, after you doing tDCS. And here we can see the quantitative EEG in a patient with migraine before and after 6 sessions of tDCS. We can see that before tDCS, she had reduced beta and high beta power, and after doing tDCS, her symptoms was better, and also she had a near normal QEEG. Here a model shows us how tDCS induces deep subcortical effects also. As we can see here, very deep cerebellar effects is shown here. Neuronal loss implicates the impairment and disequilibrium of various neurotransmitters in neuropsychiatric pathologies. tDCS modulates neurotransmitter systems, indicating another disease-modifying treatment option, such as dopaminergic, serotonergic, cholinergic, and glutamatergic neurotransmitter systems. tDCS reduces the disequilibrium between excitatory and inhibitory neurotransmitter system, as shown by magnetic resonance spectroscopy. The extent to which tDCS modulates behavior is not associated with a single neurotransmitter, but instead relates to the fine-tuned balance of excitation and inhibition. Both anodal and cathodal tDCS significantly change the ratio of inhibitory GABA to excitatory glutamate with individual temporal specificity. The graph shows a significant increase of GABA concentration with respect to glutamate concentration during the second post-tDCS measurement after anodal stimulation. Recent work suggests glial activation and alteration of intracellular cyclic AMP and calcium concentrations largely contribute to tDCS effects. Brain-derived neurotrophic factor is well known to be important for the survival, differentiation, growth, and regeneration of neurons, as well as in synaptic transmission and plasticity. Synaptic plasticity, as was said, is that if two neurons are active at the same time, the synaptic efficiency of the appropriate synapse will be strengthened. rTMS could enhance the protein expression of brain-derived neurotrophic factors. If we assume that the effects of neurostimulation come only from effects on the prefrontal cortex, we will miss the contribution of other brain areas. Various brain areas and neural networks are modifiable through neurostimulatory approaches, not only the prefrontal cortex. And here image shows positron emission tomography scan using a opioid receptor selective radiotracer before and after transcranial direct current stimulation of the motor cortex. After tDCS, a decrease in opioid receptor, that is one of the important central neuromechanisms associated with pain perception and regulation, was demonstrated. Repetitive sessions of tDCS are necessary to revert ingrained neuroplastic changes that are related to the chronic pain.
And here we had done a study with 25 patients with dementia in mild and moderate stages and 30 patients with mild cognitive impairment. They underwent 5 sessions of tDCS. 5 patients with dementia underwent sham tDCS. And also 6 patients with MCI underwent sham tDCS, that is a placebo one. A Montreal cognitive test was done before and after 1 month of the last tDCS. We observed significant improvement in patients doing real tDCS comparing sham tDCS. tDCS can help us in cases of a stroke. tDCS have beneficial role in enhancing stroke recovery if greater consideration is given to individualizing treatment and the tDCS start time post-stroke. Simulation in stroke patients with hemiplegia shows that brain plasticity capacities are greater until 3 months after the stroke than after 1 year of stroke. Here we can see the MRI of a 72-year-old after 23 days of onset of a moderate ischemic stroke of the right posterior cerebral artery. He had a severe left neglect symptoms, extensive lesions within the right hemisphere affecting mostly subcortical areas of temporal, parietal, and occipital lobe can be seen. A person with left neglect may only eat, for example, what she or he can see on the right side of the plate. You can see here the improvement of the drawing test in these patients after 1 day of tDCS and also after 5 sessions of tDCS.
Here is a video of one of my patients with stuttering. He couldn't talk or read fluently when he first came to me. And we can see him after 5 sessions of tDCS.
و تحلیل تحلیل اقتصاد و بازار را فرا روی شما خوانندگان محترم قرار دهیم تا اگر علاقه‌مند بودید با مطالعه آموزش تحلیل و مریضی تصمیم‌های
And here, after 5 sessions of tDCS,
دارایی‌ها نیز خود به 2 دسته تقسیم می‌شوند: دارایی‌های فیزیکی مانند خودرو و دارایی‌های مالی همچون اوراق بهادار. اگر در یک بازار دارایی‌هایی که مورد معامله قرار می‌گیرند دارایی‌های مالی باشند، با آن بازار مالی گفته می‌شود. به بیان دیگر، بازار مالی یکی از انواع بازارهاست که در آن خریداران و فروشندگان می‌توانند به معامله دارایی‌های مالی همچون سهام، اوراق قرضه، ارز و غیره بپردازند. بازار اوراق بهادار را می‌توان
as we can see, he showed a very significant improvement.
به 2 بازار اولیه و ثانویه تقسیم کرد.
Neuromodulation techniques are used in clinical practice for enhancing the efficacy of existing medicine, and in some cases that can't tolerate the medicine can be helpful for therapy. The relevant stimulation parameters are electrode placement, electrode size, intensity, duration, and frequency. To set up the tDCS device, the electrodes and the skin need to be prepared. This ensures a low resistance connection between the skin and the electrodes. The careful placement of the electrode is crucial to successful tDCS technique. The electrode pads come in various sizes with benefit to each side. A smaller sized electrode achieves a more focused stimulation of the site, while a larger electrode ensures that a larger region of interest is being stimulated. The effects of non-invasive neuromodulation also depend on frequency and duration of stimulation. Administration of repeated pulses at low frequency or cathodal tDCS results in a reduction in the strength of the twitch, suggesting that excitability has been modulated, whereas administration of a high-frequency pulse of TMS or anodal tDCS results in an excitatory effect. High-definition tDCS has better spatial resolution. It is a form of tDCS where current is applied through a small electrode. The small electrodes are called high-definition electrodes. These high-definition electrodes are small cups that are filled with gel. High-definition tDCS is commonly done with 5 electrodes. If our goal is to target a specific cortical structure, then
high-definition tDCS will be used. The most clinically affordable technique to follow up the patients after tDCS may be QEEG. Quantitative electroencephalograph has great potential for both mechanistic insight into temporal features of tDCS and value as a marker for intervention outcome. The question that will arise is if tDCS has any side effects. In fact, no side effects has been seen. Tingling, itching, burning sensation, headache and discomfort for about 10 minutes are the most often reported adverse effects of tDCS. Is tDCS FDA approved? While tDCS is approved for medical treatment in much of the world, including the European Union, it is currently not FDA approved. FDA has allowed several companies to market tDCS for specific uses. Several studies and experiences prove that tDCS is a valuable tool for the treatment of several neuropsychiatric conditions. What kind of these modalities is better to be used? One important recent insight in the field of non-invasive brain stimulation is that each technique has a distinct neurophysiological signature. A deeper understanding of the differences between techniques of transcranial stimulation becomes critical given the increase in the number of options and novel methods being developed. Nevertheless, few trials have compared these techniques head-to-head. In summary, neuromodulation is an evolving therapy that involves a range of stimuli such as magnetic, electric, ultrasound, photic, and biologic. This modality employs the body's natural biological response by stimulating neuronal activity. The end effect is a normalization or enhancement of a neural network. We can be sure that our understanding of neural plasticity may drive a revolution in brain-based treatments for a wide range of conditions.
Πρώτος που σκέφτηκε ότι η μουσική συνδέεται με τον ανθρώπινο εγκέφαλο ήταν ο Αλκμέων Κροτονιάτης, ένας ευφιέστατος Έλλην φιλόσοφος, ο οποίος έζησε στον Κρότονα της Ιταλίας. Ο Αλκμέων είπε ότι ο εγκέφαλος είναι το κέντρο της συνειδητής ζωής. Ό,τι λέμε εκπηγάζει από τον εγκέφαλο, ό,τι ακούμε κατανοείται από τον εγκέφαλο, η μουσική που συνθέτουμε παράγεται από τον εγκέφαλο, είναι το ωραιότερο δημιούργημα του εγκεφάλου, τη μουσική που ακούμε και εσωτερικεύουμε και να ακούμε μέσω του εγκεφάλου. Αυτή ήταν μια άποψη που διατυπώθηκε τον 6ο αιώνα π.Χ. σε μια εποχή που ο άνθρωπος πίστευε ότι το κέντρο της ανθρωπίνης ψυχής, το κέντρο της ανθρωπίνης υπάρξεως ήταν η καρδιά. Σε μια εποχή που ακόμα ο Αριστοτέλης έλεγε ότι η καρδιά χρησιμεύει σαν το κέντρο της ανθρωπίνης υπάρξεως και ο εγκέφαλος απλώς ψύχει την καρδιά και τη διατηρεί εν ζωή, ο Αλκμέων Κροτονιάτης, αιώνες πρώτου Αριστοτέλους, συνέλαβε αυτή την έννοια ότι ο εγκέφαλος είναι το κέντρο της ανθρωπίνης υπάρξεως.